Diabetic Foot Assessment. The outline of this presentation is why, when, what, and how. Why assess feet in people with diabetes? Because diabetes will result in ulcer formation, which may result in amputation, which may ultimately result in death. This shows the 5-year mortality of foot ulcers as opposed to other disease conditions. It also shows that healthcare costs increases with the progression of diabetic foot. When and how often? On diagnosis of diabetes and at least annually and thereafter in all patients with type 2 diabetes, at least annually after 5 years from the diagnosis of type 1 diabetes, and whenever patient complains of foot-related symptoms. What should I assess? In an at-risk foot, neuropathy, which is loss of protective sensation and deformity, and of course ischemia, symptoms such as intermittent claudication, rest pain, and signs such as loss of foot pulses. We must also check for pre-ulcer lesions and ulcers. How? With history, inspection, palpation, and special bedside tests. Ask the patient whether there is numbness or paresthesia, intermittent claudication, and rest pain. Ask about previous foot ulcers, smoking, and footwear practices. Look at the feet. Exposed below knees. Compare both sides. Ulcers, pre-ulcers, and deformities. Footwear. Check the fit, size, and whether there are injurious or ragged edges. Deformities. There may be claw toe, mallet toe, hammer toe, and curly toe. This shows Charcot foot deformity. This shows pre-ulcer lesions. This shows a diabetic foot ulcer. Footwear. When assessing, feel for moisture, temperature, and pulse. Palpate for foot pulses. Do bedside tests such as 10-gram monofilament test, vibration perception test, ankle brachial pressure index. At the end of the foot assessment, does the patient need immediate specific treatment, diabetic foot ulcer, pre-ulcer lesion? Is the patient at risk of developing a diabetic foot ulcer? Check for loss of protective sensation, deformity, and ischemia. Thank you.